Women's reproductive rights and health are in the national spotlight. That's in part because of a Mississippi law that made it all the way to the Supreme Court, which challenges the longstanding right to abortion established by Roe versus Wade. And if Roe v. Wade is overturned by the court, it would mean a near total ban on abortions in the state of Mississippi. With that monumental decision looming, we introduce you to the team traveling the Mississippi Delta in a van they call Healthcare on Wheels, with the mission to bring services to people who may not otherwise have access. No insurance required. ABC's Elwyn Lopez has the story of Plan A.
Mississippi, the birthplace of blues and rock and roll, known for its grand magnolia trees and vast sweeping plains and hills blanketed by an iridescent layer of fog. And in the Northwest, bound by the winding curves of the Great Mississippi River to the west and the Yazoo River to the east, lies the Delta. But in all of its splendor, it remains the poorest region of the poorest state in the country. And those taking the brunt are its people.
What's the biggest challenge regionally, do you think, in terms of what you do?
Money.
Money. People in our community need help. We all need help.
Money is scarce, and its rural landscape leaves access to adequate medical care nearly impossible. And for many, health insurance is considered a luxury. And across the country, the medically underserved could be at risk of losing even more doctors.
We've had 181 hospitals close since January of 2005 in rural communities. There's more than 18 million women of reproductive age that live in rural areas, but more than half of those rural counties have no access to hospital-based maternity wards.
And according to the National Rural Health Association, if you are a Black woman in a rural community, a key demographic of the Delta, you're 5 times more likely to live in an area that's lost their obstetric unit. That's where Plan A steps in. The mobile health clinic accessible to those underinsured or with no insurance at all, offering free sexual and reproductive services like mammograms, pap smears, and STD testing.
Do you find that it's a big taboo in Mississippi?
It is. When you talk about sex, birth control, or anything like that, that's really not talked about.
These women hope to destigmatize the conversation. To fit the needs of the community, they've expanded to add primary care services like blood pressure tests and COVID vaccines.
Talk to me about the gap. And a lot of people, the only way they can get healthcare, accessible healthcare, is through this mobile clinic.
Some people who can't afford primary care services, they can't afford them by going to a regular provider. So that's where we kind of stepping in with meeting on the cost end.
You know, a lot of people in the Mississippi Delta do not have insurance.
They got to choose whether we gonna eat or whether my child gonna go to the doctor.
And sometimes even when you're insured, you can still be underinsured. So what if you are insured, but you can't afford the co-payment?
Mississippi is one of 12 states to not expand Medicaid since the passage of the Affordable Care Act, a critical source of revenue for hospitals and a safety net for poor Americans. The federal government covers 90% of the cost for Medicaid, leaving 10% to be covered by the state. And although at least 8 expansion bills were filed in the 2022 legislative session, not one was debated.
Well, I think it goes to the argument of federal involvement in state policy. The reason that they've given for their lack of participation is the cost. At some point, if the federal government decided not to fund 90% of the cost of the expansion, then they would be stuck holding the bag.
But if expanded, the American Rescue Plan would provide an additional $600 million per year to the state and qualify more than 225,000 Mississippians. Medicaid's fiercest critics are Governor Tate Reeves and Speaker of the House Philip Gunn.
I just don't think Medicaid expansion is realistic. Personally, I'm not for it. I've said that. I've been very clear I'm not for it. I don't see that as a way forward in Mississippi. We need to be looking at ways to get people off Medicaid, not put them on Medicaid.
According to a Millsaps College and Chisholm Strategies poll, some 60% of voters say that Medicaid should be expanded. But with legislation indefinitely stalled in the Senate, rural doctors, nurses, and healthcare administrators have to sacrifice and improvise, exhausting themselves to keep their health system afloat. Caroline Weinberg founded Plan A.
You built this organization based on the belief that Roe versus Wade would be overturned.
Yes, I mean, I built the organization on the assumption that it was kind of destined to be overturned. So we don't offer abortion, which means that Roe v. Wade being overturned in really any capacity doesn't directly impact our day-to-day, but it has an incredible impact on the community that we serve. And another thing that comes up a fair amount, especially when I talk to people outside of Mississippi, is like just how significant the distance between everything is, and the fact that like 5 miles in, say, New York City is very different from 5 miles in the Mississippi Delta.
And it's not just on wheels. In Louise, Mississippi, Plan A has a brick and mortar about an hour drive away from where they're parked today in Cleveland. And about 27 miles away is one of their patients, Lisa McCarty. The single mother says she was uninsured when she was looking for some form of contraception and didn't know where to go.
What is the impact that Plan A has had on your life?
They came in right on time with the birth control.
And while she has insurance now, she is sticking with Plan A, in part because they also offer a variety of services outside of reproductive health.
Everyone knows each other, and we're so small here that it's uncomfortable because you feel like, okay, well, hey, this person may know what's going on with me, and I don't feel much comfortable.
What would you have done without Plan A if they were not around?
If they weren't around, I'd probably be struggling with the doctor's bill right now. So, or maybe another child, so.
Mississippi, a place where Southern charm abounds and neighbors are more than strangers, this group of women are living proof that the heartbeat of the hospitality state beats on.
We're small in number, but we are mighty in passion, and I feel hopeful. Often Mississippi Delta is looked at as one of the most unhealthiest places, but we're determined to change that narrative.
A lifelong impact.
Lifelong.
Yep.
Our thanks to Elwyn for bringing us that.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.